Hi, everyone. Social anxiety disorder is a common mental health condition that causes intense fear or anxiety in social situations. People with social anxiety disorder may worry about being judged or negatively evaluated by other people, and they may avoid social situations entirely or experience high levels of distress and anxiety, clenching their teeth and just getting through social situations. Social anxiety disorder can lead to all sorts of problems in work, school, and relationships. Now, social anxiety disorder is one of the most common mental health conditions, affecting over 10% of the population, and it's more common than other anxiety conditions like panic disorder, obsessive compulsive disorder, and PTSD. Now, despite how common it is, though, there are a number of myths and misperceptions that surround social anxiety disorder. And in today's video, I want to talk about 8 of the most common myths and misperceptions about social anxiety disorder and the truth behind each of them. Now, myth number 1 is that social anxiety disorder is the same as being shy. Now, shyness is a normal personality trait that involves feeling uncomfortable around new people or in social situations. Social anxiety disorder, on the other hand, is a mental health condition that's characterized by intense anxiety and fear of being judged or negatively evaluated by other people. People with social anxiety disorder may experience physical symptoms like sweating, trembling, and racing heart in social situations. And as I mentioned earlier, they may also avoid social situations altogether. So, a shy person may feel uncomfortable at a party, but they may still be able to enjoy themselves and interact with others at the party. Whereas a person with social anxiety disorder, on the other hand, may be so anxious that they're unable to attend the party at all, or while they're at the party, they are standing off to the side and terrified that something bad is going to happen to them, and they may leave the party early because they're just so anxious and feeling just so miserable. Myth number 2 is that social anxiety disorder is just a phase that people go through and that people with social anxiety just need to grow out of it. The reality is social anxiety disorder can be a persistent condition. Many people with social anxiety disorder have had symptoms and anxiety in social situations for many years, often developing their social anxiety back in their childhood. So it's something that people can experience for years, if not their entire lives. Myth number 3 is that people with social anxiety disorder are just overreacting. They're just being overly dramatic with their anxiety, and they just need to suck it up, toughen up, and get over it. This myth not only lacks compassion, but it also lacks a genuine understanding of how social anxiety disorder can actually affect a person. For example, imagine that you're afraid of heights. If you're standing on a high balcony, way up, 27 floors up, you may feel your heart pounding, your palms sweating, and your knees shaking. It may be difficult for you to breathe, and you may feel like you're going to pass out. These are all physical symptoms of that fear of heights. So even though you know you're safe, you logically know you're safe on that balcony, your body is still reacting as if you are in danger. Social anxiety disorder is similar. People with social anxiety disorder experience these high levels of anxiety and associated physical symptoms in response to social situations, even if they know they're not actually in danger. So it's not a suck it up kind of thing. Myth number 4, social anxiety disorder is rare. As I mentioned earlier, social anxiety disorder is one of the most common anxiety conditions, with over 10% of the adult population experiencing social anxiety disorder every year. So if you're in a room with 100 people, statistically speaking, more than 10 people in that room would meet clinical diagnostic criteria for social anxiety disorder. And a lot of times you can't tell whether a person has social anxiety disorder. The reality is people with social anxiety disorder work really hard at blending in and disappearing in social situations. So just because someone may not outwardly appear anxious in social situations, that doesn't mean that they're not actually anxious and desperate to get out of that situation. Myth number 5, social anxiety disorder is only related and only about public speaking. Now, while public speaking tends to be one of the more common manifestations of social anxiety disorder, it is certainly not the only social situation that people with social anxiety disorder will be anxious of. Social anxiety disorder can affect any social situation, including things like meeting new people, going to parties, dating, eating in restaurants, being evaluated at work or school, or having to be assertive and say no to someone who's trying to push your boundaries. Myth number 6, there are no good treatments available for social anxiety disorder. The reality is social anxiety disorder is a very treatable condition, and there are a number of effective treatments for social anxiety, the most common of which is cognitive behavioral therapy. Now, I've done a number of videos on some of the characteristics and features of cognitive behavioral therapy, but in terms of the treatment of social anxiety disorder, cognitive behavioral therapy aims at teaching a person how to identify and challenge negative thoughts and beliefs that contribute to their anxiety. This can include negative thoughts and beliefs that they have about themselves. This can include negative thoughts and beliefs that they have about other people in terms of how judgmental or observant other people might be. Cognitive behavioral therapy also helps teach a person coping skills to help them manage anxiety in social situations and to engage in gradual exposure to increasingly more challenging and feared social situations to help develop a sense of confidence and ability to manage in those situations. So what happens over time is that the person's social anxiety symptoms decrease and they're more able to participate in social situations with greater comfort and confidence. Myth number 7, people with social anxiety disorder should just avoid the social situations that they're anxious about. Now, while avoiding social situations can help alleviate someone's social anxiety in the short term, it's not a particularly good solution. If I'm anxious about dating situations and I manage that anxiety by just avoiding all dating situations, sure, I may not feel anxious, but I'm going to feel miserable because I'm alone and lonely and I want to be with someone. Additionally, avoiding social situations can make social anxiety disorder worse in the long run. When people avoid social situations, they never have an opportunity to learn that they can tolerate and manage their anxiety. They can never see that other people aren't extremely judgmental or critical of them. So, avoiding situations serves to reinforce these negative beliefs that fuel the underlying social anxiety. And finally, myth 8 is that people with social anxiety disorder are just weak or pathetic. Again, this myth lacks any sense of empathy or compassion for people. The reality is, people with social anxiety disorder are some of the strongest and most resilient people you'll ever meet. And the reason I say this is that a person with social anxiety disorder has to live in a world where they are constantly surrounded by people, constantly facing social interactions that could potentially flare up their anxiety. People with social anxiety disorder have to go to job interviews, give presentations, or attend social events even though they're anxious. And yet, despite their anxiety, they continue to persevere and manage to get through life. So imagine a person with social anxiety who has to give a presentation at work. They may feel so anxious that they feel like they're going to throw up, but they still push through and do it. It may be an awful experience for them. They feel terrible while they're doing it, and they feel completely drained afterwards. But they get through it, and typically no one in the audience knows otherwise. So I hope that helps dispel some of the myths and misperceptions that people often have about social anxiety disorder. If you want to learn more about the characteristics and features of social anxiety disorder, I'd encourage you to check out this video. So that's all for today's video. As always, thank you for making it all the way to the end of this video, and I will see you in the next one.